Hello there! I'm so glad you're here. If you're watching this, it's probably because you're looking for some answers, maybe about your body or just wanting to feel better. Well, you've found a safe space, and we're going to walk through this together and hopefully bring some clarity.
Feeling as though your pelvis is constantly bruised? Wow. Does that sound familiar? It's a phrase so many women have used to try and put words to their pain. And if that hits home for you, I want you to hear this loud and clear. What you are feeling is absolutely real, it's valid, and you are so not alone in this.
So, here's our plan for today. First, we're just going to acknowledge that your pain is real. Then, we'll dive into what adenomyosis actually is. We'll talk about finding an ally in your corner, look at some real paths to relief, and finally, figure out how you can take that next step. Okay, first things first. Let's just talk about your pain, because it is not something that should ever be minimized or brushed aside. What you're experiencing is a real, legitimate medical symptom, and it absolutely deserves care and attention. There are so many myths out there that can be really hurtful, like, oh, it's just normal period pain. No. Adenomyosis pain is on a whole other level. It can be severe, it can last a long time, and it can really disrupt your life. Or what about, will a baby cure it? The truth is, while pregnancy might give you a temporary break, it's definitely not a cure. And this one is so important. Is painful sex all in my head? Absolutely not. The pain is a direct, physical result of what's happening inside your womb. Your pain is real.
Okay, so we've established that what you're feeling is real. Now let's get into the why. Why is this happening? Because honestly, just understanding the cause, that can be such an empowering first step. So what is adenomyosis, really? Well, let's break it down. Think about the lining of your womb, the endometrium. Normally, it's on the inside, but with adenomyosis, that same tissue starts to grow into the muscular wall of the womb. The problem is, this misplaced tissue still does what it's supposed to do every month. It thickens and bleeds with your cycle. But since it's trapped inside the muscle, that blood has nowhere to go. And that's what causes all the inflammation, the swelling, and that awful tenderness. And all of that internal action, that's why it causes so much pain and heavy bleeding. The uterus itself can get bigger and really tender, and because this tissue is sensitive to your hormones, it just keeps the cycle of swelling and inflammation going, month after month. It creates this state of chronic inflammation that just makes everything in that area so much more sensitive to pain.
A lot of people get this confused with fibroids, and that's totally understandable. But here's a really great way to picture the difference. Think of fibroids like marbles in a bag. They're distinct, separate little lumps. But adenomyosis, that's more like grit that's been mixed all the way through a jar of jam. It's not in one spot, it's spread throughout the muscle itself. And you can see how that makes it a completely different kind of challenge. And this really brings us to something that can be so hard to talk about: painful intimacy. When your uterus is inflamed and swollen, sometimes it can even be 2 or 3 times its normal size, deep intimacy can literally bump up against it. And that causes this deep, bruising kind of ache. It even has a name: collision pain, and it can last for hours. It is a direct, physical reason for the pain you might be feeling. So, going through all of this, you really don't want to do it alone. You need a guide, right? A specialist who doesn't just have all the medical knowledge, but who also has the compassion to sit down and really listen to you. It's all about finding a true ally for your health. And that's why we're so lucky to have the insights of Dr. Farzana Khan for this explainer. She's a specialist with over 20 years of experience, and her whole approach is about putting you at the center. She believes in clear explanations, setting realistic expectations, and most importantly, making decisions together, with you, as a team.
And her expertise really speaks for itself. She has a medical degree from the University of Copenhagen, a special diploma in sexual and reproductive health. But what's really amazing is her special focus on things like vaginal health and sexual function. She even trains other clinicians, which just shows you how dedicated she is to this very specific area of women's health.
Okay, let's shift gears a little bit and talk about something really important: hope and action. I really want you to know that you have choices here. There isn't just one path. There are lots of different ways to find relief, and they can be tailored to fit your life, your body, and what you want for your future. So, before we even get into the big medical options, let's talk about some gentle things you can try at home. Simple things, right? A hot water bottle can be a lifesaver for cramping. Some women find that intimacy is just more comfortable during the first half of their cycle. If you're feeling exhausted from heavy bleeding, it's definitely worth talking to your GP about an iron supplement. And even gentle movement, like walking or yoga, can sometimes help with that heavy, congested feeling in your pelvis.
Now, when it comes to medical options, it is not an all-or-nothing deal. There's a whole spectrum of choices. You've got things like the Mirena coil, which can really help reduce bleeding and pain by thinning that lining. There are hormonal pills, of course. But there's also a non-hormonal medication called tranexamic acid that can cut down blood loss by a lot. Then you move into more advanced options like uterine artery embolization, or UAE. And for the most severe cases, a hysterectomy is the only thing that is considered a definitive cure. The whole point is that there are options, and it's about finding what's right for you.
You've heard it before, but it's so true. Knowledge is power. So for this last section, I want to give you some specific tools, things you can use to really advocate for yourself as you navigate your health journey. Okay, this is super helpful. Sometimes adenomyosis can be tricky to spot on a scan. So if you ever get to see your scan report, here are a few key phrases to look for. If it says your uterus is bulky or globular, that's a clue. Or asymmetrical thickening. That just means one wall is thicker than the other. And sometimes they'll even mention something called Venetian blind shadowing. These are all classic signs a sonographer is looking for.
Now, here's a gentle but really important warning. There's a procedure for heavy bleeding called endometrial ablation. And if a doctor ever suggests this, it's so important to ask a few more questions. See, an ablation only treats the very surface lining of the womb. If your adenomyosis goes deeper into the muscle, what can happen is the ablation creates scar tissue on top, and it ends up trapping blood inside the muscle wall. And that can unfortunately make the pain even worse down the line.
This next one, this might be a real aha moment for you. There's a very specific symptom called dysorgasmia, and what it means is cramping that happens specifically after an orgasm. Think about it, the uterus naturally contracts during orgasm, but if that muscle wall is already tender and inflamed from the adenomyosis, those contractions can become incredibly painful. It's a very distinct feeling, and it's one that really needs to be understood.
And finally, let's just quickly cover the red flags, the signs that mean you should get help urgently. If you ever have sudden and really severe pelvic pain, or if you're bleeding so heavily that you're soaking through a pad or tampon every single hour, those are signs. Same with passing clots that are larger than a 50p coin, or if you're feeling the symptoms of anemia, like being super tired, dizzy, or breathless. In any of those cases, please don't wait. Get medical care right away.
So let's leave it here. I just want to say this one more time. You deserve to be heard. You deserve to be understood. And you absolutely deserve to feel comfortable in your own body. So my question for you is, after taking all of this in, what is one small, gentle step you can take today to start your journey toward relief? It doesn't have to be huge. Maybe it's just grabbing a hot water bottle. Maybe it's making that doctor's appointment you've been putting off. Or maybe it's just allowing yourself to give a name to your pain. Every single step forward, no matter how small, is a victory. Thank you so much for being here.